Hi, my name is Dr. Marisel Medina, and today we're going to be talking about the longest tendon that we have in our body, and that is the Achilles tendon. A tendon is what attaches a muscle area to the bone, and this area is very prone to inflammation because we walk so much, do so many activities, and various types of exercises. There are two areas in the Achilles tendon, which is exactly where it inserts, and in this area up in here called the watershed area, which that area has very poor blood supply. So when the patients come into the office, depending on their age and their activities, those usually are the two zones where we will have discomfort in the Achilles tendon. The Achilles tendon, when it becomes inflamed, it usually is very similar to plantar fasciitis, in that the area is tight and stretching needs to be performed. So therefore, if you increase your activities or a sudden increase in activities, or you have issues of just tight gastrocs, many times this area will become very inflamed and very painful. Now, one thing you need to note, this area is not recommended to have injections by steroids. There are some physicians that will do that, but I will not inject in this area because that will make the tendon weaker, and we have a 75% chance of a rupture or tearing of that tendon. An X-ray is usually performed on our first visit to see if there is any spurring or any other abnormality with the bone, but my diagnostic test of choice is an MRI, which will tell me everything regarding the tendon in that area, the area of the bursal sac, which is an empty area behind the ankle, and the tendons and ligaments that surround this Achilles tendon. Once the patient comes in and we have a diagnosis and they are in pain, we will place them in a cam boot. Sometimes they'll have to be completely non-weight bearing with a knee scooter or a wheelchair, depending on the severity of the pain. We will maintain the patient anywhere between 3 to 6 weeks in this boot. During that time that you are immobilized, I will try to give you an anti-inflammatory medication if it is advisable for you and there are no health issues. And as well, we will try with ice the first 3 weeks. And then after that, I will start incorporating heat modalities and menthol rubs to the area. Once we have finished the immobilization process, then we will start the hard part of this program, which is physical therapy. We will slowly have to work on your range of motion and your strength in order to have this area not as tight or tight calves in the muscles. Therapy can be anywhere from twice a week for 3 months to 3 times a week for 4 months. Depending on your age and your ability is the amount of therapy that will be provided. Now, another thing I like to try in conjunction with this is acupuncture. Acupuncture, normally I like to recommend 1 time a week for 12 weeks minimum to see if that provides any relief along with other modalities that we have instilled for your treatment plan. Surgery is usually not performed in this area. Almost 100% of the patients will have relief from all the different modalities. Minimal surgery is usually performed for the Achilles tendon when it is inflamed. The only time usually we will go in for a surgical intervention will be if there is a rupture or a big tear of the tendon after there has been a degeneration and inflammation of the Achilles tendon. Once the patient is feeling better, I usually like to try to have them fitted for custom-made orthotics, as well as continued warming up and stretching exercises. Therefore, if this sounds like a situation that you are now suffering from, please feel free to contact me at the office. I am in the Plantation and Miami Lakes location.